My name is Marla Kennedy. I'm the Antenatal Education Midwife Manager and I provide parent craft education here in Sligo University Hospital. You will find it both rewarding and demanding caring for your new baby. It's all too easy in the excitement to forget about your own health. With everything focusing on the birth, you may not have given much thought to what happens afterwards. Everybody bleeds vaginally after the birth of their baby. Lochia describes the discharge from the womb as its lining is shed following birth. For the first 2 to 4 days after the birth, the loss will be red and heavy, similar to a period. And during the first week, the loss will diminish, becoming more brown or pink in colour. After about 2 to 3 weeks, the loss becomes creamy brown, clear and eventually stops. If you do notice that the loss has an offensive smell, becomes heavier or bright red after the first 4 to 5 days, tell your midwife or public health nurse so they can make sure you do not have an infection. Your next period may start again within the first 6 weeks, although if you're fully breastfeeding, this may be delayed.
You may feel mild contractions in the first few days after delivery, as the uterus shrinks back to its pre-pregnancy size. Painkillers, such as paracetamol, may relieve the discomfort, but take care not to exceed the recommended dose. If you have torn the perineum, the area around the vagina opening, or have had an episiotomy and stitches, you are bound to feel sore and uncomfortable for the first few days. Make sure that you take medication to relieve the soreness. If you have had stitches, these take about 2 weeks to dissolve. Clean the area after going to the toilet. Avoid constipation and drink plenty of fluids in order to keep your urine dilute and reduce the stinging. After a caesarean section, you may find it takes longer to recover your physical health and strength, and this is entirely normal. For the first few days, the midwife will examine your wound to ensure that it is healing. The main thing to remember is not to overstretch, lift heavy objects, hoover or drive in the first 4 to 6 weeks.
It is normal to feel tired after having a baby. Ask for help from family and friends. You've enough to do looking after your baby without having to worry about guests. Remember that your hands and feet might swell after your baby is born. This swelling is due to excess fluid present in the body and goes away usually within a few days. However, it can be very uncomfortable, especially in hot weather. Try to make sure you have as much rest as possible and elevate your feet while sitting. This does relieve the pressure of the fluid in your legs. Remove any tight-fitting rings if your fingers swell. During pregnancy, some women report that their hair has never been in such good condition, while others say the opposite. In the postnatal period, most women do notice some hair loss though, and this is usually very mild, so use hair products which are best suited to your hair type and ask your hairdresser's advice before having a colour or a perm. If you developed stretch marks on your abdomen or thighs or a dark line down the centre of your abdomen during pregnancy, this should fade once the baby is born. But stretch marks never completely disappear, however, and they do fade to a pale, silvery colour and thereafter difficult to see. After giving birth, your health is as important as that of your baby, so take time to discuss the challenge of motherhood. Always ask for help, even if the problem seems small. You and your baby need time to get to know each other, and that's best done when you're both in the best possible health. We also recommend that you link in with your local parent and toddler groups.